New videos every day.
Do your feet hurt?
You have fallen arches?
Does your knees hurt?
Plantar fasciitis?
How about your hips?
Trouble standing for a long time?
Do you stand on one side all day long and wonder why your back hurts?
We're actually here to help you guys today to talk about some issues that happen with people's arches. Whether you're dealing with pronation that you've heard from your doctor, or you're wearing orthotics for running, or you're just really having trouble standing around at work, this is what we're here to talk about today.
That's right. My name is Ron Vaughn. I'm a sports massage therapist. I own Athletic Tune-Up Professionals. And this is?
My name is Christy Powell. I'm the Director of Physical Therapy at CATS, Sports Performance and Physical Therapy in Austin, Texas. So when we first address the biomechanics of the foot, we're looking to see that most people have what we call fallen arches, or feet that pronate. You can see right here there's just not a nice line up from the Achilles tendon because her feet are kind of fallen towards the ground. So if she turns around, you can see on the front that this part of the foot is caving in. Now, the arch is made up of several muscle groups, and when you actually use those muscle groups to activate the arch, as if you were kind of drawing in, now, if you saw that line in the back, it would have changed. It would become straight. There, the arch is actually being corrected using the muscles. So when we have issues with the feet and there are soft tissue restrictions, or there's a weakness associated with that muscle group, this is where, a simple exercise and soft tissue work and massage therapy can actually help at least eliminate a large percentage of this problem without having to use the orthotics to address that in a shoe. So here's a pronated arch where it's fallen. You can see that the muscle starts to bulge here. If I actually have her correct her arch by using the muscles, pull up, nice. As she drew that arch in, she's actually getting muscle activation. Just like anything in life, if you don't use those muscle groups, that you tend to lose them, right? They atrophy, they waste away, you stop using them. So this is kind of where we come in to see if we can't change. Now go back to pronation, boom, she dropped that arch. This alters the mechanics of the foot, so whether you're standing, running, any kind of exercise that you are trying to absorb load and shock from the ground, if your foot is in this position, you're at a mechanical disadvantage. Good, go up. Nice.
All right. So what I'm doing is going to address the soft tissue components. As we saw how we demonstrated how her feet were all pretty much jacked up. I like to use that word, jacked up, by the way. So first we're going to check out the anterior tib and the muscles that come on top of the foot, because they come across and they rotate the foot. So we want to kind of massage all that and get all this relaxed so she can have proper mobility in her foot. So by doing some of this right under the ankle. All right. Now I'm going to show you some on the back side. Can you flip over real quick, please? All right. Muscles here also attach down to the bottom of the foot. So we're going to work some of the calf here. Again, around the ankles, the arch of the foot. So we got to get these muscles active so you could have access to them. I just hit a spot there that she loved there. But once we get these muscles active, she can use them and she can control her foot and work on some stability and strengthen up the muscles. Because if you don't use it, you'll lose it. All right. So I'm working the other foot as well, and I'm giving a better angle so you can see where I'm working all the muscles here, arch of the foot, trying to get that to work.
Because like with most athletes, most people have pain on both feet, especially this athlete. She actually, for her job, has to be standing for prolonged periods of time during the day. She's also a fitness instructor, so she's having to demonstrate jumping, running, cutting, squats, which is highly demanding on her arches, of course, but then the lower leg and So she, all the way up to the back of the knee, have some soft tissue restrictions that Ron can actually feel. And as he finds them, kind of use several different soft tissue techniques. There's cross friction, there's pin and release, there's active release, there's numerous kinds of patterns that he can use to kind of help correct some of the misalignment and areas of adhesion or thickening restrictions of any types.
Yeah, I'm just trying to pretty much get the range of motion so the muscle can function properly the way it's supposed to. A lot of people, they get overuse, like you're saying, get adhesions, scar tissue buildup. They're not able to use the muscles like they're supposed to. So that's where I come in. That's pretty good. Getting better every time. You okay up there, Emily? Yeah. It may hurt just a little bit, but it's not me. It's because you're in bad shape. Because after it's all said and done, it feels great.
It's a good one.
See, she's still restricted here. You can just see there's no muscle just at all. So you got to go in there and kind of bring it out.
We call that cleaning the gutters right there. Clean her gutters. If the muscles are restricted, you have to imagine that the biomechanics cannot work. They literally cannot absorb force for you that is coming from gravity in the ground or from some sport demand, or even if you're just standing for a long period of time, that just constant pressure on the arches and on the lower extremity is definitely significant for the body to have to kind of manage.
Wow, look at that.
Beautiful. Okay, so now that we've addressed the soft tissue restrictions and you can actually start to get access to those muscles, now we want to go back and retrain the muscles of the arch. They are literally like any other muscle in the body. You go to the gym, you work it out, they improve with strength. Arch muscles are just like this. So for all you people out there who have orthotics on, this is a great way to just get a simple exercise that you could do at home that helps to create the actual musculature creating that arch for you versus an arch that's falsely made or like a false arch that's basically placed in the foot, in the shoe for your foot. If you do wear orthotics, you always want to make sure that you're doing some kind of arch training and exercise and soft tissue work when you're out of those shoes so that you don't lose this strength. So this exercise is called pen penny. You literally need a pen and a penny. Couple things I'm looking for here. I want the penny to go under the big toe joint, okay, just slightly under it. It gives you some feedback. Sometimes I'll make it cold so that you can really tell that you're pushing on it. And just a standard pen. Pen goes directly under the middle of the arch. What I want to happen is I want this athlete to be able to push through the penny but not actually touch the pen. This is a little bit of a coordination thing for some people because it's hard. They want to actually roll the foot off the penny to get off the pen, or they want to actually squish the penny and it squishes the pen. So what this does is it gives the body some feedback that says, okay, I've got to be able to push the penny, not touch the pen. And you can see right there she's making a nice arch. She's cheating a little bit though, because what I'm looking at are these toes are trying like crazy to help her. Again, they're not a part of this. We really want this activation to come right through the middle of the foot. Some people are going to get very fatigued with this very quickly. Others, to be able to advance it, you can actually take this off of the ground and see if you can actually try and balance and hold. Excellent job. And she just gets a little bit of feedback. If she squishes the pen, she can actually tell. And what does she do? She corrects the arch. And if you can see right here, you can actually see some activation of the muscles that Ron just worked on, trying to hold that arch up. Again, they're muscles, just like anything else in the body. They can be trained to do this. So just because you feel like, oh, I have flat feet, oh, I have fallen arches, doesn't mean that you're hopeless and orthotics are the end-all be-all. Orthotics are always just one piece to this puzzle. Tissue work is another piece, and strengthening is the third and final piece. For pen penny, again, I want to remind you, make sure that the penny goes directly under the big toe joint. Not the actual toe itself, but right here where this X is, you notice the big joint. And the pen goes in the middle of the arch, exactly kind of where that X is. Now, if you're off a little bit, it's not that big a deal, but make sure the penny's got to be in the right spot. Now, there we go. Lift off of that pen, pushing the penny down, trying to relax these toes. So this is the advanced version of this exercise. This is going to be difficult for Emily here to do, but I want you to get next to a door. You're going to get a few inches away from the door, but it's going to give you some cueing. You've got your pen and your penny. You've got this leg off, and the opposite knee needs to make sure that it's slightly bent. Do not lock that knee. Keep it slightly bent. Now, what she's going to do is challenge the arch by taking her left arm and trying to cross it across and touch the other side of the door. Now what's going to happen is the arch is going to want to follow that. The body's got to resist that by activating those muscles to not allow it to follow the arm. So it makes it very difficult. Then you're going to switch and come across the other direction. Again, it wants to come off the pen now, but she's going to do everything she can to push through the penny to not allow that arch to move. So this is a great way to just add a rotational movement pattern while trying to maintain that arch. Using the pen and the penny as some cueing to let her know if she's actually keeping it or not.
Okay, so for homework at home, for a self-massage, here's something you can use. Tennis ball. Everyone has a tennis ball. Take it from your dog. It won't be bad. Hopefully they won't bite you. So you put the ball under the foot, and you pretty much just massage all around the arch of the foot, any part of the foot, and this helps you control the pressure that the massage you're getting. So you can press hard, you can press soft. Yeah. For the more advanced, if the tennis ball gets too easy for you, lacrosse ball is always good. How's that feel? Yeah. So it depends on your foot, how thick it is, how much, how dead your foot really is. The foot muscles are dead, and just you're trying to get the blood flow and get the muscles to relax. So there you go. Come on, CP.
Thanks, guys.
Thank you.
If you have any questions,
hope you enjoyed it.
holler at us.
That's right. Call us. My website's athletictuto.com.
catsaustin.com.
See ya. So don't forget to leave me a comment, give me a thumbs up, and check out the channel. See ya.